over mandatory vaccinations is gearing up in Canada. The federal health minister last week saying we need to have the conversation about making COVID vaccines mandatory. There are still millions of Canadians, perhaps as many as 7 million, who have chosen not to get vaxxed. And amid yet another variant, Omicron, another surge in cases, and another round of lockdowns, people are getting more and more frustrated and angry with a minority who will not follow clear public health advice and put others at risk as a result of that. It does come, though, as some provinces like Alberta and Saskatchewan are already shutting the door on any idea of mandatory vaccinations. Perhaps not surprising, of course, given the political leanings of those two provinces. Let's bring in our commentators. Cam Holstrom with the NDP, Jamie Ellerton with the Conservatives, Susan Smith with the Liberals. And Susan, happy Monday to you. I'm going to start with you on this, your read on what we need to know about this story.
I think you summed it up well, Todd. It's politics over science and politics over good public policy. But you do have a split even in the Conservatives. Jason Kenney and Scott Moe have taken one approach. Doug Ford has taken another approach. And in Quebec as well, there's another approach, though not an official Conservative label on it. It's about the healthcare system. It's about looking after the health of Canadians. And quite frankly, I think Premier Legault, I don't agree with his curfew approach, but I agree with his approach of inconveniencing people further if they don't have vaccinations. The latest being you can't go to a liquor store or a cannabis store because it's run by the province in Quebec unless you're vaccinated. And that's the only way we're going to make a difference for people. But I do think it's driven by politics. I do think it's driven by ideology. We have to mandate our children have to be vaccinated before they go to school. I think at some point you'll eventually see, hopefully, a reversal in Alberta and Saskatchewan as they realize that their healthcare system cannot continuously cater to people who haven't been vaccinated and push aside the people who need other health care like cancer care and hip and knee surgeries and other replacements or other surgeries that are being pushed aside because people are dealing with COVID most dominantly in the unvaxxed.
It's an interesting argument, Jamie, and as Susan put it, a healthcare system that caters to people who are not getting vaccinated. And when you look at the numbers, there is certainly some evidence of that, clear evidence, and people are getting angry about it who have chosen to, quote, do the right thing and be double or triple vaxxed. How are you framing it?
Yeah, I think Susan's also telling on herself a bit and saying this is about politics and ideology. It's actually rather baffling that in the midst of the biggest global pandemic in our lifetime, the federal government has done next to nothing to increase health transfers to the provinces. And I think when the average people look at this, Todd, they're not liberal, they're not conservative, they're not New Democrats. They're fed up with having their lives robbed from them. They're fed up with society shutting down. Anyone who I know with young kids is absolutely livid here in Ontario that their children are not in schools. And we continue to have responses from governments at both the federal and the provincial level across all political stripes, blaming it on something and say 2 more weeks and we're going to get through this. Meanwhile, there's been no meaningful investment in hospital capacity in 2 years in this country. And we have amongst the lowest number of beds per capita in the industrialized world. So there was a lot of blame and a lot of finger pointing that can go around. But the reality is Canada's healthcare system is broken. And until there's meaningful steps to fix it, 2 years into this global pandemic, we're going to continue to see this debate. And I think on the other side of the equation, specifically, Todd, as it relates to vaccine mandates, we had vaccine mandates in terms of a vaccine passport all fall in Ontario. And what did it get us? Nothing. It got us another lockdown where people who are, like myself, triple vaccinated are effectively stuck at home, working from home, and cannot get out there because our system cannot respond. And Canada is one of the outlier jurisdictions in taking this approach in the entire world.
Cam Holstrom, I see you wanting to get in, weigh in. You're shaking your head. What do you think?
Yeah, because we had vaccine passports, and that's what failed us all. That was it. That's what got everyone sick. I'm sorry about that, Jamie. I just can't agree with you there. You know what? The fact is vaccines work. We know they work. They've been proven to work over and over again. You know what? And the fact is, I remember when I started teaching my teaching career way back when I was still in the classroom. You know what? There's a list of about 8 or 9 different vaccines that kids have to take before they can go to school, before they're allowed to. We don't hear anything about that with the mandatory because it's simple. It makes sense. There are certain professions where you need to have your vaccines up to date to be in that profession. It's a condition of employment. Teaching being one of them. What the fact is that schools would be open today if we didn't have unvaccinated COVID ill people on their deathbeds filling up emergency wards. It's simple. It's A to B. It's just that simple. Because right now, especially in Ontario, it is those unvaccinated people that are filling up the COVID wards, and that's why schools are locked down right now. That's why my daughter's in front of one computer today, and my wife is in front of another trying to teach. Like, that's why this is happening. And you know what? It's not the fault of the measures that we've taken that have created this problem. It's the fault of those who refuse to do their part. So when it comes to this idea of mandatory vaccinations, it is a serious conversation that needs to be had. And it's not about politics. The only people that are making this about politics are people who are trying to ride the wave of a small minority of a single-digit number of people who want to be absolutely antisocial and refuse, who believe it is their God-given right to put the health and safety of others at risk just so they can avoid a silly little needle. Oh boy, oh pumpkin, I feel so bad for you people, I really do.
Yeah, you know what, Todd, like, I'm going to actually call Cam out here. Like, you can fight the caricature of a Trump supporter or whatever an anti-vaxxer looks like in your mind. The reality is this is complicated, and people over the course of the holidays who have been fully vaccinated and contracted COVID, anyone who I know who's had Omicron has actually had it pretty mild and described it as a cold. But the reality is Canada's healthcare system is buckling under the pressure it is facing. We do not have the capacity to deal with these surges like other jurisdictions. We have the lowest per capita ICU beds of the industrialized world. How are we supposed to go and do anything if every time a hospital system, which, by the way, during regular cold and flu season was operating 100% and above at capacity, is going to shut down society? So I think just this decamping to partisan ideological lines that we are seeing from Susan and Cam here are just detached from the reality of some bigger problems.
Let me just jump in here, though, because countries such as Germany, Austria, Italy are moving in this direction when it comes back to mandatory vaccinations. And it is interesting that there are those who try to portray it as a question of choice or freedom, or that, a push toward mandatory vaccinations is something that we would see in a fascistic country. I mean, the language gets a little bit overblown when we're talking about a public health emergency. Susan, back to you here. Weigh in.
Jamie was proposing that the solution to COVID and dealing with the overflow in the hospitals is more capacity. I think he's forgetting the magic word of prevention, and it's not exactly a magic word. There is an ability to prevent the number of people that are going into the hospitals and overwhelming the system. There's an ability to prevent the number of people who are out of work and can't help people because of COVID. And all they need to do is step up and get a very safe vaccine. Every single one of the people on this call, we've all gotten our boosters and our vaxes because we know it's the right and smart thing to do. So prevention in this particular case is exactly what we need to be doing, and we need to be encouraging. And we need people like Jason Kenney and Erin O'Toole and Scott Moe to stop dancing with the fringes of their party, trying to save not so much Scott Moe's case because he's very safe, but Erin O'Toole is not safe in his leadership role. Jason Kenney is not safe in his perch in the Premier's chair, and they are pandering to a very small segment of their population that is making the rest of us sick.
Hey, Jamie, if you had to vote yes or no, what would you choose if the vote was mandatory vaccinations or not?
I don't think it'll work, Todd, because I think when you have 7 million Canadians that you're essentially casting as others and trying to dispense them from society, I think you're creating longer-term problems. Listen, we need to get everyone vaccinated and encourage them as much as possible. Calling them racist, calling them dumb, calling them stupid, and making them feel bad is probably not going to persuade them. Actually, that's exactly what Cam just said.
Any of those words?
I did not say that. Don't you put words in my mouth. Jamie, you know what? The fact of the matter is that I have lost family to this disease. I'm not speaking from some high-minded place in some partisan corner. I know people who talk like that. They are family of mine, and we have these conversations. And I already had to see one family member die from this, and I wouldn't want to wish that on anybody else. So the fact of the matter is that you talk about people that are othered in society, they have chosen to other themselves. No one forced them to do it. They've all been offered time and time and time again. We're going on 14 months of having vaccines in hand, and these people refuse to touch them. At what point do we finally say, you know what, I'm more worried about the healthcare workers who are getting exposed to this disease, being worked to the bone, and while being threatened at the same time when they try to walk out the door of the hospital or at home? I'm more worried about them than I'm worried about the 7 million. Yes, and I want to apologize for that. I'm not calling them stupid. I'm not calling them racist. I'm calling them selfish. because at the end of the day, people are dying. People are being denied health care because of this. And if you want to say there hasn't been enough funding, you're right. I can point to Doug Ford, who's pocketed money from the feds to go pay down his debt rather than reinvest in the healthcare system. I can point to liberal governments that haven't done it. There's a long list. We can have that conversation. We need to have that conversation. But that's not going to deflect from the fact that these people are making this go on longer.
Jamie?
Yeah, just like Todd, to come back to the politics of this is clearly an issue that is dividing society. And anyone who's looked at the sociology and the public health aspect of this tells you beating people who haven't gotten vaccinated over the head to go and get vaccinated is not going to work. Susan actually touched upon one of the policy measures in terms of the SAQ and the cannabis store in Quebec, now requiring it to be able to shop there. Again, it's going to be small targeted measures that are going to get this done, not this grandiose proclamations casting others aside as if this is going to change. I disagree with these people fundamentally, but if we're being honest in terms of how we're going to solve this, yelling at people and calling them names, whether it's selfish, stupid, or whatever you want, is not going to see this through. And it's too easy for Minister Duclos in Ottawa to stir this up as an issue when fundamentally this is a provincial issue. So if the feds want to do something about it, they should put money on the table and show a way, as opposed to just send the minister out to do a news conference and stir the pot.
Susan, it's interesting, though, that the federal government has said it's the province's jurisdiction. I mean, some cynics among us might say, well, that's a great way for the federal government to avoid being the bad guy.
Well, it's actually a constitutional reality, Todd. All of us who took Politics 101 know that, and maybe a refresher, healthcare is a provincial jurisdiction, and the provinces scream every time the feds try to step into it. Education is a provincial jurisdiction, and the provinces scream every time we put the feds try to step into it. So what we need to do is continue to be collaborative at the table to look for solutions. I think a vaccine mandate would be a good thing for the provinces to do, because it would be inconvenient for those people who refuse to get vaccinated, and they would then have to decide, do you want to go buy your beer? Do you want to go buy your pack of bud? Sure, you have to show your passport, and that's what's going to happen in Quebec. And already the numbers, we're seeing that the numbers of people getting their first shot, it was up, they did 6,000 in a day in Quebec on Saturday, and it had been down in the 1,000 range. So that kind of inconvenience works. Nobody is name calling, just to reiterate that. I think Jamie was trying to put words in people's mouths, and that's not in fact the case. But I do think, as Cam has shown, people are exceptionally frustrated. It's impacted families, and it's an ideological reason that people are choosing not to do it. There's medical exemptions for people who need to have a medical exemption, but for everybody else, there's no reason that you can't go get a jab. The science is there.
I appreciate all three of you coming on. Spirited debate, which we like and is important. Jamie Ellerton, Cam Holstrom, and Susan Smith. Have a great rest of your day.
Thanks, Todd. Take care.